If you're wondering what the best labor position is for your birth, whether you have no epidural or you decide to get an epidural, we're going to break it down in this video of what positions may be most optimal for you and when to do them. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula.
And I'm Roxanne. I'm a labor and delivery nurse and student midwife.
And we're going to break down what labor positions can be best for you during your labor based on a few different factors, such as where is baby within your pelvis and whether or not you have an epidural, because epidural labor positions are going to be a little bit different than the positions that you can do without an epidural. But before we dive into what the best labor positions are, I want to share that my book, Training for Two, is now available for pre-order. Training for Two comes out September 10th of 2024, and it's all about how you can use prenatal fitness to support a strong pregnancy with lifting modifications for each trimester, a pain-free pregnancy because pain is not a requirement of pregnancy, with pelvic stability and core exercises, and to help you prepare for birth with birth preparation exercises such as pelvic opening, pelvic floor release, and we even talk about different positions that you can do to help support your labor progress. You can check out Training for Two down in the notes below. And again, the book comes out September of this year, shortly after this baby is due. So before we dive into what the best labor positions are, we first need to understand how you can tell what the best position is. And this is going to depend on where your baby is within your pelvis. So if your baby is still very high versus if they're engaged or very low, different types of movement patterns are going to create different types of space within your pelvis. The very top of your pelvis is the pelvic inlet. This is where your baby is going to first enter or engage into the pelvis. Movements that create more space in the pelvic inlet are going to involve external hip rotation with abduction. So the legs moving out as the knees go out and the ankles come in. And so this is going to create more space side to side in the top of the pelvis. In addition, pelvic tilting from front to back can help to change the pelvic diameters as well. And so when we tilt our pelvis more forward, or that anterior pelvic tilt, it changes this pubic bone angle to make it easier for your baby to enter, in addition to making it easier for you to find more external hip rotation. And then the opposite is that posterior pelvic tilt, where we're tucking the butt underneath. This is actually going to move the sacral promontory backwards to help create space front to back. And so there are a variety of different movements that you can do to help create space in the top part of the pelvis to help your baby engage. And so if your baby is still kind of high in the pelvis, doing movements to create space there can be super beneficial. So let's break down a few labor positions that you can do without an epidural and with an epidural. There's a variety of different labor tools that you can utilize to help you be more comfortable in different labor positions. And one of them that we're going to show is the Rebozo. The Rebozo has a lot of cultural significance for the indigenous population of Mexico. And so this one is specifically handmade in Mexico, and we'll link the company down below. So if you want to support them, you can. The Rebozo here is a lot higher quality than the cheap ones that you can get off Amazon. And so if you're looking for a labor prop, I would highly recommend checking them out. But do know that their website is in pesos, and so don't be alarmed when you look at the prices. So with the Rebozo, we can find supported squat positions by either placing it underneath your arms, or you can place it across your partner's back. So with the supported squat, I'm going to start with it underneath my arms just to provide a little bit of support. And then I'm going to come down into the squat and trust my partner will not just let me go. And then here I can just kind of hang out in the position. And so I have more of that external hip rotation. I can either go forward and backwards, or I can sway side to side if that feels more comfortable for me to help create more space in the top part of my pelvis. In addition, you can take the Rebozo and put it across your partner's back. So I like to crisscross it like this, because if you put it directly behind the neck, it's really uncomfortable. And then you could hold on to it as you come into your deep squat position for some additional support. And in this position, because we have a little bit more lat tension, it can also help to pull your sacrum backwards.
And you as the partner, it's important for you to find a supportive stance. So usually staggering the legs can provide a more stable stance to be able to support them versus two legs together. It might be easier for her to pull me over. And if you have an epidural in place, a squat may not be accessible to you just due to the epidural. So there are things that we can use with a peanut ball to kind of simulate being in a squat. So we're going to place the peanut ball between the knees. So that's creating that external rotation, so wide knees. You're going to put the knee like over the middle portion. It looks almost like that's where your knee is supposed to go. And then your feet are going to come together on the other side. And you can stay exactly like this. This is giving that external rotation that you want, or you can extend the hips out. So by bringing the feet out, and this is creating more of an open hip to kind of just change the position of the pelvis. And then you can just lay like this for about 30 minutes on each side, or until you feel almost a shift in your labor.
The next level of the pelvis is the mid-pelvis. So your baby has entered and engaged, and now they're going to have to rotate through this space here. And so the mid-pelvis is going to open more with asymmetrical movements or shifting our weight from side to side. The upper mid-pelvis is going to open more with open hip positions on one side. So essentially the knee is moving away from midline, while the lower mid-pelvis is going to open more with closed hip positions. So belly moving towards the thigh. But in general, you can just sway and shift your weight from side to side, and this is going to create more space throughout the mid-pelvis. And so once baby has engaged, they then need to rotate through this space, and that's where all those asymmetrical movements are helping them do. And so labor positions that you can do without an epidural to help create space within the mid-pelvis could include these like elevated lunges where you have one leg on an elevated surface, and we're just kind of shifting our weight into the leg and back. If you're not sure which leg to do, try both and see which one just feels better for you, and that's usually the side that you should focus on. But as baby gets really low in the pelvis, you may prefer to find more closed hip positions where you're kind of shifting your belly towards one thigh instead. You can either elevate your foot on a yoga block, or I usually find folks will kind of come up onto their tippy toes to kind of shift their weight towards that one leg to create more space in the lower mid-pelvis to help baby finish their rotation. But overall, just swaying and shifting your weight from side to side is going to create space throughout the mid-pelvis.
So if you have an epidural, obviously you can't get up out of bed and do a standing lunge. So we're going to use our trusty peanut ball to be able to get into that lunge position while you're laying down in bed. So we're going to put the peanut ball in front of the bottom leg. The bottom leg is going to be straight, either like kind of pushed back a little bit, kind of wherever it's comfortable. And then the front leg is going to be on top of the peanut ball, where it's like the full shin is on this peanut ball. And then again, you're going to kind of go into this externally rotated position. The upper body, just kind of lay comfortably. Some people like having pillows underneath the head. It doesn't really matter as long as you find that you're like comfortable. You're not being like rounded and squished up top. And then during a contraction, your partner is going to put both hands onto your shin and kind of do a rock. So you're coming out to external and then pushing back into internal rotation. So open hip, closed hip. And this is during that contraction. This is giving that movement in the pelvis to allow baby to shimmy down into the pelvis and be born.
So this is just a quick sample of different labor positions that you can do to help create space within your pelvis based on where your baby is at to help with a smoother labor process. And so if you want to learn more labor positions and when to do those positions, dive deeper into pelvic mechanics, check out our online childbirth education course. We have an entire section on pelvic mechanics, labor positions, to include epidural labor positions, because 70% of us are going to opt for an epidural. So it's important to know the labor positions that are still going to help facilitate your labor process. You can also check out our online prenatal fitness programs for exercises that you can do during pregnancy to help ensure that those movement patterns are more accessible to you. So we want to make sure that we can open the top of the pelvis, the middle of the pelvis, and the bottom of the pelvis, and we can do that with our prenatal fitness workouts. We offer our prenatal fitness programs in an app-based format, which is going to be a list of exercise with short demo videos, and then also an on-demand of full-length workout videos that you follow and work out with at the same time. You can check out all of our courses on our website at mamastayfit.com and use code YouTube10 to get 10% off, and you can bundle childbirth ed and prenatal fitness together to save an additional 15% off.
Which makes it pretty much free.
Pretty much. So thanks so much for watching. If you enjoyed this video, be sure to like and subscribe to our channel. We release new videos every week to help educate you on your pregnancy, your birth, and beyond.